It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions of peace of mind, real power, real control, and so that you can influence decision-making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my readers, and the question last week was, my fiance is breathing on his own. Why do the ICU nurses keep on saying he still needs a tracheostomy? You can check out last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the questions from one of my clients, Peter, as part of my one-on-one consulting and advocacy service, asking why the ICU team has not informed him early that his dad is in the ICU and having end-stage renal disease. So today's episode is my dad in ICU is having end-stage renal disease. Why has the ICU team not informed me earlier? So I'll read out some email exchange between Peter and myself. So Peter writes, Hi Patrick, Dad's making some progress. Kidneys working again, 2 to 3 liters a day now with Lasix drip and hydrochlorothiazide drip dose and to remove excess fluid. Why does Dad need such a large dose for his kidneys? Generally speaking, he does one transition from IV drip Lasix about 20 milligrams an hour to pill form after discharge. However, creatinine at the moment is 3.1 to 3.7. I'm praying that it won't go higher anymore. Dad is breathing on his own and awake, sitting up on the chair bed, but on the ventilator, as a precaution until lungs are clear. Blood pressure is normal, stable now without medications, and he's back on the feeding pump. Doctors aren't sure if Dad has a lung infection or no sputum culture, or not. Sputum culture is negative. They stopped the antibiotics, so several concerns continue. Thank you very much from Peter. Here's my response. Hi Peter, that's great news. So he's getting 20 milligrams an hour of IV Lasix and he's getting rid of around 2 to 3 liters of fluids per day. That's great news, especially if he can escape the dialysis machine because of that. Given that they now started to sit him up in bed with a breathing tube, they're very proactive in trying to get him off the ventilator, hopefully soon. Not every ICU is that proactive. That's really great news, Peter. 20 milligrams an hour of Lasix is a fairly high dose, but in some instances I have seen up to 80 milligrams an hour. The goal should definitely be to reduce the Lasix as quickly as possible and let the kidneys do their work again. In order to do that, creatinine also needs to come down in order for the kidneys to kick back in again. Creatinine of 3.1 to 3.7 suggests moderately damaged kidneys. 0.6 to 1.2 are normal creatinine levels. High doses of IV Lasix can certainly damage the kidneys, and therefore it should only ever be a temporary therapy and never long-term. Again, as discussed this week, the kidneys are probably the most quote-unquote forgiving organ out of all the major organs such as the heart, lungs, liver, brain and kidneys. Given time, kidneys often do recover, but they need to be monitored by regularly checking fluid intake, urine output, and obviously by checking urea and creatinine regularly. Your dad is certainly not out of the woods yet, however, given that they are drying him out, so to speak, by draining 2 to 3 liters per day, given that he's now more awake, given that he's now breathing on his own and sitting up in bed, that's all very, very encouraging, Peter. Sometimes when people are severely fluid overloaded and you quote-unquote dry them out, the lungs often see an immediate effect, which is what I think happened to your dad. Furthermore, with being so fluid overloaded, it didn't surprise me that when they were lying him down on the ward, that he desaturated and ended up in ICU intubated. Now you can see the opposite effect when starting to make lots of urine in a short period of time. It might have also helped if they have done a bronchoscopy and suction out any excess secretions. It probably also helped having him quote-unquote, only on propofol instead of midazolam or Versed for sedation because propofol is short-acting and midazolam or Versed is a long-acting sedative. Therefore, once they stop or reduce the propofol, your dad should definitely wake up reasonably quickly. You don't see that with midazolam or Versed because once patients in ICU are on midazolam or Versed, it takes them a lot longer to wake up. Therefore, midazolam or Versed is for longer-term induced comas. Next, keep an eye that if they do resedate him, that they stick with the propofol if possible at all. Given that he's more awake now and breathing on his own, it's probably also a sign that his infection is clearing up if the samples came back negative. Also, the combination of fluid overload and an infection in the lungs is a recipe for needing ventilation. Now that everything seems to clear up, your dad's improving. Again, normal blood pressure is usually also a sign that there's no infection. Keep in mind that with draining so much fluid now, your dad might become hypotensive, which is a low blood pressure, because of being fluid depleted. They need to keep an eye on that. Concerns continue for sure as long as he's in ICU on a ventilator. However, when we last spoke, I was very worried about your dad because at his age and in such a fragile state, you just never know. Nevertheless, it sounds like he's making progress for now. If he is breathing on his own and his ABG, his blood gases, his oxygen saturation, if his chest x-rays are clear, if he can cough and if he can obey commands, he should be able to come off the ventilator soon. Keep up the good work, Peter. Let me know what you need next, and you look after yourself as well. Don't forget the most important person in all of this, that's you. So, here is Peter's response. Hi Patrick, Dad is still on the ventilator until remaining fluid removed from the lungs. Dad slept all day yesterday but occasionally opened his eyes today. The registered nurse told me Lasix is being reduced after much water weight has been removed and lungs are clearing and creatinine slowing to 3.8. The doctors want to do an MRI to rule out brain trouble while on the ventilator and lying flat in bed. What are the pros and cons regarding whether or not to do an MRI, which will help with the diagnosis yet no treatment offered, which is concerning. I am concerned about Dad's sleepiness as well. Have you seen the doctors using any alertness drugs or treatments like Provigil with any success? Thank you so much, from Peter. Here is my response. Hi Peter. When you say your dad was asleep all day, do you know if he's still on any sedation such as propofol or midazolam? Also, do you know if he's getting any painkillers such as morphine or fentanyl? If he's opening eyes, is he making eye contact and or is recognizing you? Do you think brain trouble needs to be ruled out by an MRI? i.e., is he moving his arms and legs on purpose? Are his pupils equal and reactive to light? I am concerned about your dad's sleepiness if, number one, he's off all sedatives and opiates or painkillers, and number two, they suspect there has been a neurological event such as another stroke. I have not seen the use of propofol in ICU. What I have seen is the use of naloxone for morphine fentanyl or overdose, or flumazenil for midazolam or Versed overdose. Therefore, in order to determine why your dad is still sleepy, we need to look at how much sedation he's still on, or if he's off it, how much he's had in recent days. Once we've established that, then we may be able to determine if a CT or MRI of the brain is feasible. Also, do you know how well he's breathing? I can be available for a Skype call pretty much any time, but very happy to talk via email or over the phone if you prefer that. Kind regards. So Peter has been an ongoing client of mine, and we spoke regularly over the phone and via email as well. So if you are scrolling down below this video, you can also read the rest of this consulting session, which is a transcribed phone consultation. And if you are watching this on YouTube, please click on the link and go to our website where you can read the email consulting session, but also the phone, the one-on-one phone consulting session with me and Peter. This one-on-one consulting session will also continue in next week's episode. Thank you for watching. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section where you find more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me, find international phone numbers on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting and advocacy with me via Skype, over the phone or via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.